Okay, this video is on surgical asepsis. So you have the objectives and key terms that you need to be able to define. So first thing we're going to go into is sterilization. So definitions, there's medical asepsis. So it's a method of reducing pathogenic microorganisms in the environment and intervening in the process by which microorganisms are spread. So surgical asepsis is the process of creating and maintaining an area that is completely free of pathogens, and sterilization is the complete destruction of all organisms and spores used from equipment used to perform patient care and procedures. Chemical sterilization, the immersion and soaking of clean objects in a bath of germicide solution, followed by sterile water rinse. Not recommended for surgical asepsis, one of the least satisfactory methods because control of effectiveness factors, time, solution strength, temperature, and contamination is difficult. Autoclaving. An autoclave is a device that produces steam sterilization under pressure. The most common used sterilization methods, quick and most convenient means for items that can withstand heat and moisture. So there's conventional gas sterilization, so method that uses a mixture of gases heated to 135 degrees Fahrenheit, used for items that cannot be autoclaved, such as electrical, plastic, rubber items, and optical wear, telephones, stethoscopes, blood pressure cuffs, and other items used in isolation rooms. Very effective, but has drawbacks. So the gas used is poisonous. It must be dissipated by aeration in a controlled environment, and this process is very time consuming. So gas plasma technology is safer than conventional gas sterilization, so there's no toxic byproducts, which is a big plus. Able to sterilize heat and moisture sensitive items in greater volume, so it's more cost effective than conventional gas. It cannot completely replace gas because it's not as effective on items with long, narrow lumina. So cannot be used on cellulose items, so linens, etc. Dry heat. Used in Great Britain and tropical countries. So there's many types. There's a vacuum chamber with an infrared heating element and is most popular and effective. Temperatures range from 329 to 338 degrees. It's less expensive than autoclaving. Advantages over autoclave and gas. So needs only for heat to penetrate, whereas other methods come into direct contact with the surfaces of the object. To be effective, more effective for articles in sealed tubes or containers and for powders and ointments. So the disadvantages requires 1 to 6 hours. Some objects cannot withstand the high heat. Sterility indicators. So there's a chemical indicator that changes color when sterilization has occurred. It's used to identify whether a pack has been sterilized. It's placed inside and outside the pack to show that the gas, heat, steam, or gas plasma has penetrated all surfaces. And you can see here we have the tape. So that tape is just clear masking tape, and then once it's been through the sterility, it has the black stripes, and then you have this document here. Typically, it changes colors. Okay, so sterile field, defined as a microorganism-free area prepared for the use of sterile supplies and equipment. So, steps to establish a sterile field. Place the pack on a clean surface within reach of the physician. Just before the procedure begins, break the seal and open the pack. Unfold the first corner away from you, then unfold the two sides. Pull the front down towards you. Do not touch the inner surface. The inner wrap, if there is one, is opened in the same manner. You have now established a sterile field. Surgical asepsis and standard principles. So any sterile object or field touched by an unsterile object or person becomes contaminated, and you have to get rid of it. Never reach across a sterile field. Organisms may fall from your arm into the field, increasing the risk of brushing the area with your uniform. So be careful. Don't touch that sterile field. Don't reach across that sterile field, and watch your scrubs that you don't brush it or anything. If it does, throw it away and start again. If you suspect an item is contaminated, get rid of it. Do not pass between the physician and the sterile field. So Go around the physician, even if they're standing 3 feet back and you think you can fit in between. Don't do it. Never leave a sterile area unattended. No one would know that if it was contaminated. A 1-inch border around the perimeter of a sterile field is considered the buffer zone and is treated as if it were contaminated. So you can touch 1-inch perimeter all the way around the paper. Okay, skin preparation for sterile procedures. So you're going to obtain a skin prep set, so a bottle of antiseptic for painting on the skin. The preparation set includes a basin, liquid soap such as Physiderm, gauze or sponges, a razor, towel, forceps, and a medicine cup. Wash your hands. Place the patient in a comfortable position and ensure privacy. Explain what you're going to be doing. Expose the area larger than the preparation site. Keep the patient as completely covered as possible to comfort and modesty. If there's hair, you're going to shave it, okay? So if hair removal is not ordered, take out steps 6 and 7. If hair removal is ordered, use a dry razor to shave the small area at a time. Hold the skin taut with one hand and shave with short, firm strokes in the direction of hair growth. The same concept applies when using an electrical razor. So, wipe the area with sterile gauze sponge wetted with alcohol. Remove the hair. Perform hand hygiene and put on gloves. Pour a little of the antiseptic into the waste container to clean the lip of the bottle. So you're going to just dump just a small amount into the trash can, and then you're going to pour the medicine cup with the antiseptic. You're going to grasp several gauze sponges with the forceps and dip them into the antiseptic. You're going to paint the skin with the antiseptic starting at the center in the area and working outward in a circular pattern. Do not scrub harshly, but remember that friction is more effective, okay? Allow the skin to dry and then repeat it again. Wash it one more time. Open the pack containing the sterile drape or towels. The physician wearing the sterile gloves will drape the area surrounding the prepared site. Surgical hand scrub. So this is just the traditional method. So wear surgical attire and appropriate personal protective equipment. Use the foot or knee lever. Adjust the water flow and temperature. So wet your hands. Add a few drops of antimicrobial soap and water as needed to make a lather. Wash your hands and forearms thoroughly. Use one brush and soap to clean your hands and nails, and clean under your fingernails with a nail cleaner under running water. So we're going to show you exactly how to do this. Rinse your hands and arms thoroughly, keeping your hands higher than your elbows. Take care to avoid splashing your scrubs closed because the dampness may moisten your sterile gown, causing contamination. Using a second brush and more soap, the actual scrub begins. The prescribed number of brush strokes is usually 15 strokes to the nails of each hand and 10 strokes to each area of the skin, which usually takes about 5 minutes. All right, so fingers and hands should be visualized as having 4 sides. Each side must be effectively scrubbed. Starting with the fingernails, scrub them vigorously, hold the brush perpendicular to them, then scrub the sides of each finger and the palms and the back of the hands. Divide each forearm into thirds and use a circular motion to scrub each side of the forearm and elbows up to 2 inches above the elbows. So keep your hands above your elbows while scrubbing and add small amount of water as needed to maintain a good lather. When scrubbing is complete, disregard the brush. Rinse your hands and arms thoroughly from fingertips to elbow in one motion, so it's one swooping motion. Allow the water to drain off the elbows. Turn off the water with the foot or knee control. Keep your hands above the elbows and away from your body entering the surgical suite, backing through the door. To dry, grasp the corners of a sterile towel and pat from the field, allowing the towel to fall open. Bend forward at the waist and hold your arms away from your body and above your waist. Dry your hands and then your arms thoroughly, rotating the towel as required. Take care not to contaminate the sterile field. The towel or your hands. You are now ready to put on gloves, gown, and gloves. All right, surgical scrub, alcohol-based hand rub method. So here, wear surgical attire and appropriate personal protective equipment. Use the foot or knee level, adjust the water temperature, wet the hands and arms, lather with approved non-antimicrobial agent, clean the nails, run the water, dispose of the nail cleaner, discard the nail cleaner. So rinse hands and arms under water, dry hands and arms using paper towel, dispense the manufacturer's recommended amount of alcohol rub into the palm of the hands. Do not use water with the hand prep. Dip the fingers in the opposite hand into the hand prep and work into a lather. Work it under the nails. Spread the remaining hand prep evenly over the hands and forearm just above the elbows. Use additional hand prep. Repeat 7 to 9 with the other arm. Repeat 7 through 10 if recommended. To facilitate drying, continue rubbing antiseptic hand prep into hands until dry. Keep scrubbed hands and arms in view. Avoid contamination. Allow air dry completely before putting on a gown and gloves. Sterile gowning and gloving. Okay, assistants open gloves and sterile gown pack. Lift folded sterile gown and step back away from the table, allowing gown to unfold inside the gown towards you. So insert arms in the sleeve. Do not allow hands to protrude through the cuffs. Assistant fastens gown at neckline. With dominant hand remaining inside the sleeve, pick up a glove with the non-dominant hand. Insert the non-dominant hand in the glove. Stretch the glove over the gown. With the non-dominant hand, pick up the second glove. Stretch the glove over the cuff of the gown. Closed gown is complete. Separate waist tie from the gown and pass it to the assistant. Turn in a circle, wrapping it around you. Sharp tug on the tie will allow it from contaminating the tab. Allow you to fasten the tie without contaminating your gown. Open glove technique. Perform hand hygiene, obtain gloves, and check for correct size. Open outer wrap and unfold the inner wrap. Expose the gloves open end facing you. Open inner wrap completely, taking care not to contaminate gloves or unwrap them. Grip with one hand. Grip cuff fold glove for opposite hand. Put glove in, touching only the inner surfaces. Using glove hand, grasp the second glove under the cuff. So that's where you guys keep screwing up. Grab it under the cuff, insert the hand in the second glove, put the second glove and unfold. Insert the fingers into the cuff of the first glove and unfold. Gloving's complete. Keep hands out in front of body at a safe distance from uniform to avoid contamination. Wound dressing. We don't do this often, thank goodness. So, removal. Wash your hands. Inform the patient what you're going to do. Use care in removing the dressing to prevent cross-contamination of the wound and yourself. Remove the dressing gently to avoid hurting the patient. Place the soiled dressing in a plastic bag and seal it before adding it to the biohazard container. Remove your gloves following the same procedure used with isolation techniques and perform hand hygiene. Applying a sterile dressing. You're going to need sterile gloves, sterile drape, sterile gauze, tape, and normal saline. When supplies are assembled, proceed the following steps outlined in the next slide. Tell the patient what you're going to do. Perform hand hygiene. Tear several strips of tape to a convenient length. Open the sterile drape pack, placing the drape near the patient. Partially open the drape by pulling from the corners. This creates a small sterile field for your sterile items. Open the dressing pack and add your sterile dressing to your sterile field. You will need to cleanse around the wound. Drop the sterile gauze sponges into your field for this purpose. To moisten the gauze sponges, open a small vial of sterile saline. Recheck the label. Pour a small amount of saline over the sponges. Do not allow liquid to soak through the sterile towel. Check the label for the third time before discarding the vial. Put on gloves and use the open method for describing sterile gloves. So use a moist sponge to clean gently around the wound. Allow the area to dry. Apply the dressing over the wound and secure it with tape. Cover the patient, dispose and any waste and remove your gloves and wash your hands. So we actually are going to do all of this. It's good that you look at it in your book. Take a look at the images. I know this was wordy, but it's really important that you are able to do this. Okay, so make sure you read your chapter.